I know that like this doesn't come to them well.
Oh, I'm good.
Maybe it was a document.
I leave on Sunday.
What do you know about the meeting?
Especially since that was on the list.
With your.
No,
No,
there's
you're
already
any on the wall, they want to be easy.
there with the World War.
I think one meeting.
No, they did the battle folder.
Okay. That's, I just had a long day, I'm just not going home. Oh. I'm running from one thing to another today.
Been trying to
It's like that.
kiosk in. Once they send support letters.
2 million.
Yeah, I've been following stuff, yeah. Didn't even call, Mike's like, you coming this, awesome. What's coming, she's a little cross.
Yes, Cindy, you want to sit here?
Oh.
Is there,
There's a plug right here.
Barb.
I would go.
Barb.
I just have her here.
Maybe how we something now? Yeah. I mean, I.
Oh,
Broken.
that takes a while.
So I was trying to charge it up.
That's maybe.
There we go, just don't trip on it. Here, I'll see it. You get like.
We're, no, we have been raising.
Oh, I don't think. Oh,
That's Christian.
Now I'm just doing soil
Bring
testing.
lots of years of knowledge.
Oh, great. My own projects, and I do a few septics on my own,
And
but it seems like I'm.
it'll be on.
Success, Legion.
They're going to college,
Trying to do some work.
but majority of them are going to the summer cemetery.
Semi-retired, but. That's 7. Yeah, great.
We're doing our first.
But I also see this little saying one time.
Yes,
That already job.
Prearranged.
Do you have to email it?
I emailed it to Jane and then.
Okay.
Perfect. I'm sure we just sent.
Well, think about it.
Is there any way to put it in the folder? or no? That's,
Yeah, I can do it.
okay.
I'm so excited.
That way, if they can,
I
then
just
they
wanna
can
get
put it up.
Check it off.
What?
Go on, like 50,000 miles. Much ran my goons. But I don't get it, yeah.
I know the way.
And I was mobilized. Here.
Oh, stays.
Yeah, they were just.
2, 4, 5.
Here I do this.
How many we need? 6.
There's gonna be 9 at Richland Center Cemetery.
This be left.
That's it.
There's changes.
Francis Bradley's.
Oh, Cindy, that's because you
Oh,
moved.
yeah.
How did you move?
Shove a plug in that.
Yeah, there are changes.
Made a last minute request, so if you guys are okay, you're still. No, Jamie, don't rush. My fault for throwing this at you 2 minutes before.
I just want to make sure if it's in the folder or.
He's gonna, I was just there.
Oh.
Some of the old board.
Change.
Changing.
We're getting.
They're saying by law that she has to do. People got realized that.
Okay.
For your partners.
Oh, no, it's just another transition behind the process. And many different things.
Oh. Oh.
Oh, did you see that? Oh, it's something in your name.
Yeah, just trying to see if it's pulling in. My iPad has the worst.
Well,
Okay.
what happened to up there? What does that say? That Muller, Franny in
That's
the office.
April 11th, HHS and Veterans Agenda Data.
And when Franny's
I'm
brother,
not sure what this even is.
he lives in Muscatine, he got. Doug
Oh,
Stick.
that was just,
So it was,
Oh, there it is.
this is an
it was
email.
addressed to,
materials. Okay, so are you trying to get to the?
Somehow it got Doug's name, and it ended up in Muscat.
There we go.
But it, but it,
Okay, here.
it had Doug's name.
Well, it does that and then it's like, never mind. Oh, wait, maybe now?
Doug's name, his address.
Yeah.
And how you can,
That's what happened.
how you can construe
From when I
that.
was on the board.
Committee members, if you,
It is.
if you guys sync your folder again, Jamie just added another file.
Yeah, that was.
Hopefully that will pull in.
What is it?
It's, you already know about it. It's the appendix that talks about the committee structure. I just wanted to go over Jamie. Yeah.
What do you have to sync a folder?
Busy?
What do you have to sync a folder?
Like pull it down.
When you have it open or?
There you
That's
go.
fine, yeah. Actually, Trisha, do you mind emailing it to me because I can't even get it to sync in the old folder, like, it's giving me so many problems.
Files.
We had your first meeting.
Okay. I think I'll be around this one. I went, I did.
Yeah.
What are we looking to bring in?
It would be, it's number 6. Yes.
Public comment?
No,
It will be 06 Appendix A, committees and other board and commissions.
oh, perfect, thank you. Oh, it should open up for me, there it is. But it's not, I don't know, did anybody get it to pull into their,
Great.
So now I've got a lot of work ahead.
Yeah, you do.
I agree. I do too. I am not very familiar with, same.
Veterans.
We're trying to get to whatever just got sent.
We just uploaded.
To
it.
resync.
Just uploaded it. It's got a resync because.
Yeah, cause.
And I don't know how to
mine-
sync to begin with, so.
Oh. Oh, wow.
Yeah, there's.
There you go.
Yeah, Trisha, I just realized in the
Do it too.
like the description of it, it doesn't list veterans at all. And I wanna say, when I talked with Trisha, like, I think statutorily, the commission is.
It does
required
that.
to twice a year, doesn't, or if they have to, and I think if they had to report anything, it would go right to
That's what I was.
county
wondering.
board. I don't think it comes to us. That's not right. Okay,
I don't
Yeah,
have.
so I think
it at all.
completely separate, yeah, I think. That's my impression. That's kind of why I wanted her here to make sure I wasn't saying anything wrong, but.
But again, she said if we.
Okay, well, at least we have the document now, so. All right, sorry, everybody. Are you?
This is just an extension of my computer at my house.
Is it ready? Okay.
For 18 minutes.
Oh, hold on. Okay.
Yeah.
All right, everybody, we're gonna call the meeting to order. Thank you for your patience. We don't have the separate microphone, so I will try to talk loud enough for you, Don, okay?
I'll pull it up here.
All right, so we're gonna call the Richland County Health and Human Services and Veterans Standing Committee to order. Don, would you please lead us in the Pledge of Allegiance?
Where's the flag?
You're facing it.
You're facing it.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
One.
one nation, under God, indivisible, liberty and justice for all.
Thank you. Approve of notification.
Yes.
Okay. And we have a 17-point agenda. I have a motion to approve that agenda.
So moved.
I'll second.
Second, all right, all those in favor, please say aye.
Aye.
Okay, did anyone have any notes or corrections or anything to the minutes from last month?
I read them through. They look good. I move we pass it.
Okay, thank you. Do I have a second? Okay, all those in favor of passing the minutes, please say aye.
Aye.
Any opposed? Okay. Public comment. Is there anyone here from the public, online or in person that would like to speak? Hello, welcome.
Yeah, just briefly, I'm Molly Bond. I'm a field representative for Congressman Derek Van Orden, so I attended one of these meetings previously. So just in the area, but Yeah, so thank you guys. Just a quick update from our office, Constituent Service First Office. So helping people with federal agency problems is our main priority in our district office. So last year we closed over 500 cases or 800 cases and got back over $500,000 back to constituents, as well as helped several veterans get 100% disability rating. We're also got some medals that are going to be represented to a World War II veteran next week or in 2 weeks as well. So we're very proud of that and our district team doing that. On the Veterans Affairs Committee, working very hard on introducing some new legislation there, as well as the Veterans Affairs Committee is coming and doing a field hearing next week, Friday, in La Crosse at Western Technical College. So if you or any veterans that are interested in attending that, you can reach out to our office for more information or RSVP on that. So, but just here, if there's any questions, let me know. Or I know Derek was in Richland County a month and a half ago and met with the county administrator and a few other department heads here. So he enjoyed his visit and always wanting to extend his support and his thanks for all you guys do for the constituents in Richland County. So, thank you.
Thank you. Number 7, our VSO's summary. Is that?
Yep, if, anybody has any, excuse me, any questions on the expenditures for the month?
And it looks like you also put in a copy of the calls and walk-ins.
Yes, that's the quarterly report.
Okay.
I think that's item number 8.
Okay. Does anybody have any questions for Ms. Mack? Your report.
So far, we're doing really good on our big, huge review that we've been doing. We're now just finishing up probably within the next 2 weeks, and then we'll be sending out individual mailers to veterans that are residents of the county but have yet to visit our office, just to let them know, like, we're here, just as a, gentle reminder. So that's what we're doing. We've been pretty busy, so we're keeping busy for sure.
Thank you. Any questions? Great, thank you. That will take us to our consent items, numbers 9 through 11. Didn't really see anything of note on number 9. I don't know if you had any comments on that.
I don't have any specific comments. Do you guys have any questions? Anything jump out at you, maybe clarification on?
And then for our budget, looks like we are now reporting for.
I had originally planned to, but I was able.
I was gonna say, I thought we were not.
I was able to pull this together, so we're all good. It's literally just 2 months worth, so.
Okay.
So honestly, I don't know that there's really anything I can say that would say, hey, yeah, we're definitely gonna end up with that kind of surplus at the end of the year. And really, what it's showing now is really the tax levy that's kind of in there that is still kind of set aside right now, because we're currently just drumming down all of our various allocations from the different revenue sources. And so that's really where that's at right now. And it's too soon to tell as far as any of the utilization percentages that fluctuates so much throughout the year. Like, for example, building operations right at the top, it looks like we're over, but at the first in January, they pulled down all of our insurance, right? All of our, they zap us for all of our liability insurance, all those different insurances. So nothing really there. And like CCS, that's really technically only 1 month. So. The placement report again, nothing really to say at this point.
We don't have any, I see in the child institutional and detention. Was there, did you guys say there was one that aged out? And
Yes.
we had just had one?
Yes.
Okay.
Yes. Yeah, so that's gonna be the big change there.
Okay. Anyone have any questions on numbers 9 or 10? Okay, if not, we'll move to number 11. Was there anything that we needed to know on that one?
I think the biggest thing to note is we do have some contracts that are trending very high. Those are CCS clients or CCS contracts. We have found we're having an increased number of people, lots of referrals to our CCS program. We continue to grow that program, and so those contracts are going to go up. It's just reminding that those are pass-through funds, so we bill Medicaid and are able to pay for those through Medicaid billing. We will probably next month or the month after that be bringing these contracts back, revisions.
Right, okay. Okay. So that takes us to number 12. We need to approve contracts. I did see a couple on here.
So the first one is an amendment to an existing contract that we have for Mo's Transitional Living Center. We are requesting an additional $30,000 to bring our contract up to $79,500 for a youth that is currently placed there and who will be transitioning out. So we're asking for the $30 to bring us up to what he's going to utilize.
Okay. And we need to do these separately, correct?
Yeah.
So any questions on that? If not, I would take a motion to approve for Mo's Transitional Living Center. Thank you, Carrie. Do I have a second?
Second.
Thank you. Any further discussion? All right, if not, all those in favor of approving that contract amendments, please say aye. Any opposed?
Okay, the next one is we are asking approval to enter into a contract for $50,000 with Whispering Pines Custom Builders to provide home modification services for families enrolled in our Children's Long-Term Support Program and our Behavioral Health Services Unit.
So one thing I want to note about this one is this is for our CLTS program. And in that program, families are allowed to choose their provider. These will be larger amounts. And so we do also have to get approval from the state to be able to spend that much money on these asks. So right now, we have one family that's needing a ramp that'll cost about $4,000, but we also have a family getting a quote for some bathroom modifications and a ramp for their home. So that's where we've been looking at that dollar.
And these are also reimbursable, correct?
Yes, there's zero county levy.
Okay,
And those are all families that have chosen Whispering Pines as their.
Yes.
alrighty. Can I have a motion to approve this contract amendment? Or new contract, I'm sorry. Thank you. Do I have a second? Thank you, Francis. All those in favor, please say aye. Any opposed? Okay. Number 13, approved purchase of new vaccine refrigerator.
Sure. Hi, good morning. This is Brandy Anderson, Richland County Public Health Officer. I submitted an agenda cover item to request approval for the purchase of a new vaccine fridge. It's a Helmer model, a 25 cubic foot approximately size unit. This is a pharmaceutical grade vaccine fridge. The reason for the request is we currently have ARPA funding available to purchase this item. Would like to do so. This would be a more appropriate type of refrigerator to store our federally funded vaccine in. There's some mechanisms, some digital mechanisms that would help us to keep a very close look at the fridge temps, which is required by our unit to do. So yeah, I did some research. I reached out to other health departments. This is a very common type of refrigerator and product that's used among many health departments in our state. I even reached out to our local hospital and did some research as well, and it's a highly recommended product. So we did previously have the same type of product in our public health unit several years ago until it malfunctioned. This is the same size of unit that I'm looking to replace that we had previously.
But is it a different brand?
No, this is the same brand we had. So that unit went out and Our previous health officer, Rose, had to replace that and got we have right now is a K2 scientific model. It's much smaller than this.
Okay.
It's working, but we have 2 fridges in my vaccine room and then a freezer. So some of our vaccine has to be frozen and that there's no problems with that. The K2 scientific model that I currently have is quite small. It just barely holds our required vaccine. And then the other fridge that's in that vaccine room is more of a commercial, like a Frigidaire model upright fridge. We can get away with using that for our VFC program, but it's recommended to use more of a pharmaceutical grade fridge. So I'm looking to get rid of that kind of commercial upright fridge. What we use that for mostly right now is the overflow of our flu vaccine, which is a lot, it's a large volume of vaccine that comes in all at once in the fall. To store it all appropriately, I really feel strongly that I need a pharmaceutical grade fridge back in my unit.
Okay.
What was the fridge that we got 2 years ago?
That was the K2 scientific model. And there were some issues, I guess, with it. It arrived, I believe, at the end of 2019. And then there were some issues as far as it maintaining temp. Then they had to replace that. I think it was under warranty. So then another K2 replaced it, and that's what we currently have in there. It's pretty small. It makes me a little nervous. I don't know.
Will this refrigerator that you're anticipating buying be large enough to accommodate what we need today and what we'll need in the future?
Yes, sir. I believe it will.
Okay, I move that we accept this.
Perfect. Do I have a second? Thank you, Mr. Steve. Any further discussion on this? Oh, do you have a question? Are you seconding or question?
Yes, I have a question.
Okay. Can we wait till we have a second then, and then we'll discuss? Is that okay?
I'm sorry.
We have a motion on the floor right now.
Oh,
I need a second.
We don't have a second.
Do you want
I
to?
will second them.
Thank you, Mr. Steve. Now, what is your question?
My question with regard to vaccines, recently I heard on the news that they're coming out with a new vaccine, booster vaccine, particularly applicable to the elder and to young people. Do you have any information about that?
I guess specifically, I don't know which product you're referring to or which.
COVID.
Oh, for the COVID product. I believe that continues to be changing and they are probably continuing to update the formulation of that. So whatever the most current formulation of the COVID vaccine is recommended is what we will keep on hand in our unit.
Yes. This news release seemed to indicate that they have a new and improved version
Okay.
and would be available shortly, I guess. Now, when people come to your office for a vaccine, is there a fee or not?
So for the COVID product, the rules of the program, for the COVID specific product for our vaccine, the rules of the program changed last year. And now that it became commercialized and it's quite costly to carry that product, we can carry a limited supply that's still funded by the government, for lack of a better explanation. We can provide that vaccine to uninsured and underinsured populations. For adults, we can do that through the end of 2024. And we carry the Pfizer specific product because that's what we're most familiar with. And we can also administer and carry that to children that are uninsured, underinsured, and meet requirements. So those are the populations we can give it to at no cost. Otherwise, we do have to recommend that people that are insured need to access that through like pharmacies or hospitals or clinics. Does that answer your question?
Yes, that's very good. If Medicare and Medicaid fits in there somehow?
I believe the Medicare, well, the uninsured and underinsured, whatever they explain to us when they call, if they're Medicare eligible or Medicaid eligible rather for kids, we can accept those kids and give that vaccine to them at no cost, and for adults for a limited time.
Those on Medicare?
Not on Medicare, Medicaid, and Medicaid eligible.
Well, thank you very much.
You're welcome.
Okay, any other questions relevant to the refrigerator?
I have a question.
Yes.
Just because I'm always of the mind that everything fails. Is there something, well, it does. So have we thought about 2 3/4 size fridges or something, you know? It would give you more capacity. I'm just money wise. That way, if one went down, you'd have an emergency backup next door. I mean, we do it in septic pumps all the time.
You'll still have the K2 though, right?
Yes, my goal is to have the K2 be our backup.
Okay, good.
And then the commercial fridge that will remain in the HHS building in a pinch, if we have to go down, which I hope never happens, knock on wood. My hope would be that we could access that commercial fridge again and maybe clear it out in a pinch if we really needed to for an emergency.
That's my only concern, just have a backup plan.
I think we still have the old fridge too, yeah, that was over there.
Really?
I think it's at the fairgrounds if
Yes.
So it's actually running?
I think the compressor one, I don't know what happened, but it wasn't functioning anymore.
It's operable, we use it to store food in it. Like temperatures and stuff.
Well, we do monitoring on our fridge temps daily, twice a day. And it wasn't maintaining the fridge temp. I wasn't the health officer at the time, but I did have to monitor those temps and it wasn't holding the appropriate temp that's required for our vaccine program. So I don't know what to tell you about that fridge.
All right, are we ready to vote? Okay, all those in favor of this new fridge, please say aye.
Aye.
Any opposed? Okay,
Nice report.
yes, thank you, Brandy. And that moves us to number 14, our administrator report.
So I just wanted to let you know that in the folder was our unit updates, a couple of highlights. We did hire a new CCS CLTS birth to 3 worker through Southwest Wisconsin Workforce Development Board this past month, and we also have a CCS worker that gave their notice of resignation, so we will be hiring another worker in that unit. And as I stated earlier, our CCS program is really expanding and we continue to get referrals on a regular basis. In our ADRC, they will be part of the Senior Expo, and there are other units who will also be there on April 24th. I want to make note that Jamie Bruckner, this is her last meeting here. She will be going to the Disability Benefit Specialist position in the ADRC starting next week. And they're also, Rose Welsh from Public Health is going to be our Elder Benefit Specialist, so there's some movement within the department. But we do want to wish Jamie good luck in her next endeavor. With Rose leaving as one of our public health specialists, one of the things that we're looking to do is advertise for either or, a nurse or a public health specialist. Ideally, Brandy would like to have a nurse, but with our struggles in the past, we want to advertise for both. But letting you know, we will only hire for one. We have hired a child and youth services manager. Kayla Williams will be starting in that role on the 22nd of this month. She was previously a worker in that unit and then went to the ADRC for a few years and now is returning to where she began when she began with the county. And then lastly, we will be participating in Youth Government Day next week. It's students from Weston, Ithaca, and Richland Center that will be coming here to learn about government. So we're excited for that. This is the first year we'll be doing that. Any questions on anything?
Thank you. All right, that takes us to the HHS board structure discussion. So Jamie added the description of the new committee structure into your folder, if you can get it to sync. I have not been able to get it to sync. Did anyone else, did it pull in for you? Well, otherwise she's gonna pull it up here and we're gonna go over it.
Is this the one you're looking for?
Oh, that looks like the newest one.
email,
Did
and I
you
sent
send
it to
me?
Jamie.
Okay,
I want her to try to pull that up.
Oh, that's. Okay. Yes, that looks like the current one. Okay, so first we'll look at this and then we'll look at the actual description of this. So I wanted to discuss this because HHS is going to look different, the board structure, after this meeting. So it's a little bit hard to see, but we consolidated, so overall in No, that's okay. We moved from the number of standing committees that we have down from, I think it was 9. Is that correct, Terry? Down to 5. So you can see them along the top there in green. We have the Executive Committee, Community and Health Services, Natural Resources, Public Works, and Public Safety. Underneath that, it shows which departments report to or are underneath that over writing, like, I'm sorry, I'm struggling for words today. Standing committee. So the one that I want to focus on, of course, is the Community and Health Services. So now, as you can see, there's no veterans portion to that. We'll talk about that in a little bit. It's also changing the number of members to 9. And so that will include Health and Human Services, including the Commission on Aging and Disability, Child Support, and then in red, and we're going to discuss what that means too, is the Pine Valley Committee. So then if you don't mind flipping to that other description one, we'll look at that. Okay, yeah, so it goes down to B, talks about Community and Health Services Committee. Okay, so it's gonna have 9 members. 6 of them will be county board members, which will get appointed by our Committee on Committees, and then 3 at-large members. And all 3 of those will have to have a demonstrated interest in human services and public health. It will still include the requirements, which this doesn't list it. I don't know if there was an updated one that listed it, but we still need to have a doctor on the board, a nurse on the board, and there's one other.
A person that utilizes services.
Services, yep, that's what it is. So that will have to be encompassed in this. And it will function as the Human Services Board. It functions as the Commission on Aging, the local Board of Health. So this does fix our issues with fulfilling the Board of Health statutory requirements. We had a little bit of trouble. We had tried last time with the way that we had combined Health and Human Services and Veterans to make sure that we were still fulfilling our Board of Health requirements. But it was a little bit cumbersome with the number of committee members that we had. And so we ran into some difficulty there. With the 9, that's going to take care of that. It's going to provide oversight for child support. And then it just talks about the rest. I think the main changes, and Tricia, you can help me remember, included one thing we didn't have before, right? On this list, or am I wrong?
I think the biggest thing is that we went from 11 to 9, so
9.
we're in compliance with public health.
Yes, and then we don't have, so the veterans will not be a part of this anymore. So veterans is still going to have a commission, which is statutorily required. And that, I believe, I was speaking with Candace the other day to make sure that I understood. That is statutorily required to meet twice a year, and then they can meet more often than that if they need to. Obviously requires veterans members on there, but it is not going to report to us. If there were anything that needed to be reported, I mean, they're going to be under the supervision of, as a department head of Candace. The Veterans Commission, if they would need to give any information to the county, would actually come directly to the county board if they needed to report something. So it's not going to report to us. So for those on this board that were a part of the Veterans Board, if you are still interested in serving in that capacity, Candace said to speak with her because she will be appointing the 3 members that need to be on that, or will be recommending for that commission. Does that make sense? Then the other thing that's going to be different is the Pine Valley Committee, which if you scroll down there, yes, right there. So this is why it was in red. It's going to have 6 county board members and 1 citizen, which are going to be is appointed by the administrator and confirmed by the county board. It is a committee, but it's a subcommittee of and would report to our committee. So the change with that is prior to this, the Pine Valley Board was reporting to directly to Finance and Personnel, I believe. They met alone on their own and then reported to Finance and Personnel. And if anything needed to go on to County Board, it went from Finance and Personnel. If you remember on that committee structure document we had, we no longer have a Finance and Personnel Committee. We have an Executive Committee, which is going to function and will cover the Finance and Personnel requirements. However, Pine Valley no longer will have to send any of their, like if they had something they needed to move on to County Board, it does not need to go to that Executive Committee. It would go directly to our committee and then we would send it on to County Board. This does not mean that the Pine Valley members of that board have to come to our meetings every month or need to report to us every month. It's only if they had something that needed to be moved on or needed to be reported. Does that make sense?
We're a liaison then for them to get to the
Exactly.
county board.
Exactly. That's all it is. And it's not really any change for them in operation because they were already a liaisoning. That's not a right word.
Yeah.
They were already doing that with finance
Finance
and
and
personnel.
personnel were their lead, was their lead.
Thank you. That's a better way to state it. Now it would be the community, I still struggle with this new name. Community and Health Services Committee instead of Finance and Personnel.
Big changes. We need to start always calling them the Pine Valley Committee.
Committee,
It's
yes.
no longer a board of trustees.
That is according to the attorney that was helping us formulate this document as well as restructuring or re-going over our board rules. According to him, that is an outdated term to call it a, what was that?
Board of trustees.
Board of Trustees. So it is now a
Nineteen
committee.
54. The laws don't even pertain to it anymore.
So what does that mean for us? Well, obviously, there's going to be a lot of changes as far as the makeup of this board, because any of us that are here that are county board members that don't know if we're going to be on this committee anymore. The committee members that were from the my goodness, I'm struggling with language today.
Citizens.
Thank you, that we're citizens. Haven't had enough coffee. That's not going to necessarily change. However, the veterans members would no longer be on this particular board.
And that will start as of next.
That will start as of next month. So as I said, if you're still interested in serving as a representative for veterans, then please speak with Ms. Pesh because she's going to be taking care of that appointment.
Imagine if there'd be any difficulty getting somebody on that. I've been elected to the school board now, so it'd be nice for me to shed this. So, I've really enjoyed it. This has been good. But they were in the process of reorganization, cutting the numbers. I think it's a good thing and making it more efficient is good, so.
Hopefully. One other thing that this will change is probably the day that we are meeting in the month. So this is not official yet. And it will be, I believe, decided at a committee level, but I think the recommendation is going to be that all of these committees, the 5 committees, meet in the first week of the month so that if anything needed to be addressed or go on, it will all get done before the county board meeting, which is later in the month. So that for us most likely would mean that we would just move from the second Thursday to the first Thursday of the month. Again, that's not official yet. If that changes, you know, we let people know. So when we go to adjournment, we don't know exactly what day we're going to be adjourning to be determined. But anyways, any questions for me on this? I'm sorry if I should have had this in there earlier, and I'm sorry if I didn't do a very good job explaining. I hope it made sense.
So for those of us who are citizen members, do we need to be reappointed then at this committee of committees meeting?
I believe so. I don't think that there would be any changes. Like if your term limit isn't up, then you know, I think it's just gonna be.
You would see Administrator Peck.
It's not at the committee of committees you'll be appointed, you'll be
By
appointed by
Administrator.
Administrator Peck.
Yeah. And
Approved by the county board.
Committee on committees is for us to decide.
I apologize. I don't remember like the term, like when you guys were all.
Well, the thing is, we've been reorganized at least.
I know, exactly. It's all gotten confusing. So she will look at that. I don't foresee any different, like I would think that you and Dr. Barris and Director
So
will
the
continue
word around
on.
town just needs to be any citizens that are interested in being members need to contact the
Well,
administrator.
Well,
Cindy filled the nursing role because we tried to go for the nurse, but no nurses submitted, so we went to a person.
Healthcare
public,
person.
And you filled that nurse person because you're still a licensed nurse at this time. So that's how that works.
that will look,
So I might be,
And Sherry was a nurse too, I believe.
but she's on the better.
but she's on the veteran, so that would probably not.
And then
yeah.
Francis filled the consumer, the person needing consumer
And
needs.
Dr. Barris, of course, was the doctor.
Yes.
So, yeah, I guess we'll have to, Ms. Pesh was hoping to be here today. She's not able to be, but if you guys want to speak with her afterwards, I'm sure she'd be happy to talk with you and look specifically. I'm sure it's in here somewhere, but I'm not positive where all the like term times and everything is. Any other questions? Dr. Barris, I see you're online. Did you have any questions or comments?
Not really. I assume that I'll be continuing on the committee unless there's somebody else interested.
Yes. That would be my assumption, and I'm sure you will hear if anything changes with that. And we will make sure that you guys get updated on the time and date of meeting times too. Okay, any other questions on that? All right, well then I just want to take a minute to thank each of you that have been serving on this committee. I just really appreciate all of your work, and thank you for the privilege of being a chair for the last couple of years. You guys have made it a pleasure. And I especially want to thank the Health and Human Services Department and all of you. You guys are, I've seen so much growth. So I started on the board back in 2017 as the RN member before I was on county board. And I've just watched so much change and growth happen and have learned so much about what you guys do. And there's still so much to learn. And I'm just always blown away by the amount of work and the dedication and commitment from all of you. And I just want to say thank you. It makes me proud to be a part of this community and know that we have you guys working for our community. So thank you very much for that. And I'm sure the board agrees with me in thanking all of you. So yeah, this might be goodbye to everybody, but it's been great. So thank you all. Any other comments or questions before we adjourn? Yes.
I'd like to express my appreciation as well. You've done a good job leading us, Tricia, and your team. I mean, you've been wonderful. I think we've got an outstanding group here, and I'd like to continue. So, thank you.
Great, thank you. All right, any future agenda items? I think we have discussed that the way that the budget reporting is going to look a little bit different. Did you want to share what you're thinking with that?
The budget report, I don't know that's necessarily going to be different, but right now, currently I've been doing it to the date, right? So like if we were to meet May 2nd, to have me turn around and get you the information from April 30th would be a little, it'd be. I'd be burning the midnight oil for a couple of days. So it's just sort of shifting what I'm reporting out, right? So like in May, then I would do the first quarter, like January, February, March, instead of adding that April on. So it's really just a matter of information.
So May 3rd would be okay then?
Sure, you bet. Sure, May 3rd.
Only till 11.
Yeah, but yeah, no, so that's really kind of.
But that's good to know when we talk about our schedule.
Yes.
Yeah, and I think if we do try to go in that first week, it's kind of unavoidable. We'll just be a month, I guess, later, so to speak, on budget reports, which should not be a big deal.
Or even, I mean, and really right now too, that placement report is like that, right?
Right.
The placement reports.
Well, it should be a week instead of the end of the month, the third week of every month.
Yeah, right, yeah. So I'll just be pulling data a little differently, so.
Okay, thank you all again,
Thank you.
thank you. We don't know exact date of adjournment, but I will take a motion for adjournment.
So moved.
All right, motion and a second, thank you. All those in favor, please say aye.
Aye.
Any opposed? All right, we're adjourned.